Hello guys, myself Alan. Today I am going to share you how to learn blood analysis and urine analysis. I know when you start your third year, everyone told you that blood analysis and urine analysis is the most difficult part. If you know how to crack this, your third year is easy. Okay, and every seniors will tell you this is so hard, you have to start studying. But today, what I am going to do is I am going to make yourself easy by teaching you the main concepts of how to solve any of the blood reports. Okay, without further delay we will get diving into the topic. Okay, so let's start with introduction. Okay, so like introduction, first I have to tell you some disclaimer that before going into this topic or learning anything, you might know something. Okay, so you may think, oh, I know this, why I need to watch this video or like that. But for you to completely comprehend what I am going to teach you, you have to keep a beginner's mind. Okay, I will keep everything section by section. So in order to know, we need to know the basics. Without basics we can build a home, right? Basic is the main thing, we have to make it. So you can see hemoglobin. Okay, so what is hemoglobin? Hemoglobin is the thing which gives the red blood cells red color. Okay, so in RBC there is hemoglobin. Okay, so it will give RBC red color. So you can see this is the thing, it will give red color to the RBC. Okay, and there is color index. What is color index? Color index is the thing, like our normal blood color is red, right? So if it is less it will be pale, and if it is more it is dark brown. So we can tell it is a hyperchromic if color index is high. Okay, so and if color index is low, we can see in pale. In some case of anemias it is color index will be low. Okay, so like that we can distinguish it. Okay, and what is reticulocyte? Reticulocyte, okay, in order to know the reticulocyte, there is bone marrow. Bone marrow is producing what? RBC. So if RBC is less in our body, what bone marrow will do? Bone marrow will try to produce more RBC in order to compensate the loss of RBC which it has done. If in case of blood loss anemia, like, or if an accident happens, or post hemorrhagic anemia, like that anemias, our RBC is losing. We are losing so much of RBC. So what bone marrow will do? It will produce more red blood cells. So reticulocyte activity will be high. That's why we will tell it as hyporegenerative, hyperregenerative, regenerative, normoregenerative. So I will tell each and everything once again because this is the pure basics. If you know this, everything will be easy. Okay, that's why we are spending more time in the basics. So hemoglobin, you know, erythrocyte, color index, you know, erythrocyte, you know, that is red blood cells. Okay, and reticulocyte is the production of bone marrow. So if it is high, we can tell it as hyper regenerative. Okay, if it is low, it is hyporegenerative. Okay, ഇവിടെ കട്ട് ചെയ്യണം, കാര്യം ഞാൻ ഇരിക്കുന്നിടത്താണ് ഞാൻ അത് വെച്ചത്. Okay, so if it is high, we can tell it is hyper regenerative. If it is less, we can tell it is hyporegenerative. Okay, so it is over, reticulocyte over, color index over, and hemoglobin we know. And what is MCV? MCV is mean corpuscular volume. So every red blood cells have volume. So according to the size, we can can know the size of the RBC. So it can be normocytic, it is the normal size of an red blood cell. It can be microcytic, the size will be less. It can be macrocytic, it is in megaloblastic anemia we can see the macrocytic cells. In MCV we can know how to find the cytic, how to find the size we using MCV. Okay, and color index, how to calculate color index? They will give HB. Okay, if HB is 86, okay, we have to calculate, multiply it by 3 divided by erythrocyte. Whatever the erythrocyte they are giving, we have to divide it. Okay, So we will get an answer that will be the color index. Okay, and MCH is mean condensed hemoglobin. Okay, its normal value is 28 to 34. If it is also below the normal, we can tell it is hypochromic. If it is high, we can tell it is hyperchromic. Okay, the same like color index, but this equation is like hemoglobin divided by erythrocyte. Okay, so it will be 2 point, like we will, if 120 we will tell it as 1.20, like that we will take it. Okay, so MCH over these are the basics. So now we will know the normal values. Okay, you can see normal values of erythrocyte is 3.5 to 5.5. Hemoglobin is 120 to 160. Color index is 0.85 to 1.05. So if it is less than 0.85, it is hypochromic. If it is greater than 1.05, it is hyperchromic. Okay, in how hypochromic and hyperchromic will come, you have to know. If blood is losing in blood loss anemia, what will happen is our RBCs are also losing. Okay, RBCs are giving red color to the our blood. Okay, so if RBCs are going, our color of the blood will be pale. Okay, so we can tell with color index what disease it is. And in reticulocyte also we can find which disease it is. Like if it is hyper regenerative, like bone marrow is producing more cells. In blood loss anemia, the bone marrow will be producing more cells. So like that we can know everything with the reticulocyte and color index, almost everything. Okay, and MCV I have discussed, mean corpuscular volume 80 to 100. So in most of the cases they won't give. But if you want to calculate the MCV, I will give an equation. It is rule of 3. Okay, so I will teach you that right now. Rule of 3, that is like you have to, if the hemoglobin is 86, you have to take it as, it will be gram per liter. Okay, so you have to take it as gram per deciliter. Okay, gram per deciliter. So 8.6 into 3 into 10 divided by, in decimals you have to take the RBC. Okay, so like that you can calculate the mean corpuscular volume. So if you want, you can calculate yourself and learn it. Okay, and we will directly going towards the RBC disorders. And I know everyone have confusion that how to find RBC disorders. Is there WBC disorders? We have to write the shift in RBC disorders, everything. So we will cover everything in depth. Okay, this will be the scratch to mastery. Okay, so you can identify at a glance at any disease which you get. Okay, so it will help you in exams and as well as for your self learning. So we are going that much deep, so I suggest you to keep watching till the end. Okay, so this is a disease. Now you can see a blood report of a patient. Okay, in here what you can see is 2.8. in exam what you have to write is, if 2.8 it is anemia, you have to write it is anemia. If hemoglobin is, 120 is the normal, 70 they are given, so we can call it anemia. Okay, color index is 0.75, the normal is 0.85, so we can tell it is hypochromic. And you can see the reticulocyte is 12%, normally is up to 1.2, right? So it is 12. So what bone marrow is doing, it is producing more cells, more red blood cells. So bone marrow activity is that much high, so there must be a problem, right? So that problem is blood is losing or RBC is losing from the body. So reticulocyte is high, which we will get the clear cut idea that bone marrow production, bone marrow activity is high. It is hyper regenerative. Okay, hyper regenerative. And leukocyte is in normal. If leukocyte is in normal, we can see there is no inflammation or no infection, nothing is going on. So it is clear cut that there is no undergoing infection or inflammation. And band neutrophils is 4%, segmented is 54%. So there is no shift. So don't worry about shift or anything, that I will teach you in this video later, because we don't need actually this right now. So I will teach you in depth everything in the coming sections. Okay, And basophils is 0%, eosinophils is 2%, and lymphocyte is 37. Everything is in normal. So reticulocyte is high, erythrocyte is anemia. So with this conclusion, we can tell this is an blood loss anemia. Okay, blood loss anemia. Okay, and you can also tell this is an post hemorrhagic anemia. It's easy to tell is blood loss anemia. So there is no thing in like both are same. Okay, like you can tell third stage or anything, that up to you, but blood loss anemia, it is the disease. So erythrocyte is less. What when you get a report, you have to look the erythrocyte. If it is less, you can tell it is anemia. And hemoglobin, it is anemia. Color index hypochromic. After writing everything, you have to conclude it with your conclusion, blood loss anemia. Okay, now we will go to other disease. Okay, so in this case also erythrocyte is less 3, so we can tell it is anemia. So hemoglobin is 60, we can tell it is anemia. Color index is less, hypochromic, and reticulocyte is less. Okay, so reticulocyte in this case is less, so there is no bone marrow activity. So there must be any undergoing disease, that's why bone marrow couldn't produce that much red blood cells. Okay, so leukocytes is 4.2, it's almost in the margin, so we don't need that. So others all are up to mark, and platelet is less comparatively. 200 to 400 is normal, but it is 180. Okay, so contents of iron, it is 5.7. If they give the value of iron, it is common sense. The normal will be 12.5. So it is iron deficiency anemia. So, but we have to write everything according to that. Hypo-regenerative, okay, like because of reticulocyte is less and everything, we have to, and iron deficiency anemia must be our conclusion. Okay, anemia. Okay, so these are the things we should do. Okay, iron deficiency anemia. And that's two diseases are over. Now we will jump into another one. Okay, you can see erythrocyte 1.2 anemia. Okay, hemoglobin anemia 60, color index is 1.5. So 1.05 is the margin, 0.85 to 1.05. So 1.5 is hyperchromic. Okay, so color is dark brown. Okay, so more more hemoglobin, more color is there because of any undergoing disease, and reticulocyte is still not producing enough. Bone marrow activity is very less because reticulocytes are very low, so it is hypo-regenerative. Okay, and leukocyte is in 4 to 9 is normal, it is 4, so it is okay. And basophils and band neutrophils 1, it is normal. Band is up to 6. Okay, normal value, so it is everything in normal. Lymphocyte also normal. Platelets are less, so it is thrombocytopenia. Okay, thrombocytopenia. So if platelets are less, thrombocytopenia, we have to write everything. And poikilocytosis and anisocytosis, which means there is a defect in the size and shape. Okay, so and they are mentioning it is megaloblast. Okay, so I told there is a normal red blood cell. If size is less, it is microcytic. Okay, if it is large, we can tell it is macrocytic cell or megaloblast. Okay, if megaloblast comes, which can either be vitamin B12 deficiency anemia or folate deficiency anemia. Okay, so they are given another hint that jolly bodies and kappa drinks. So it will only come in which type, megaloblastic type of anemia in B12 or B9 deficiency, folate deficiency anemia. Okay, so we can conclude it as B12 deficiency or folate deficiency anemia. Okay, and it is megaloblastic anemia. We can megaloblastic type, it is megaloblastic cells are present, megaloblastic type of anemia. Okay, so most of them are finished. And now we got another one. Erythrocyte is 1.2, hemoglobin is 37. So hemoglobin is very less. Anemia, hypochromic is hyperchromic. It is no, it is normochromic. 0.93 is normochromic, so no defect in the color. Reticulocytes is border, so that is everything is okay. So we can tell reticulocytes is normoregenerative, and leukocytes is less. So leukocytopenia is there. Leukocytes are less. Okay, and there is defect in poikilocytosis and anisocytosis. So that there is a defect in the, so leukocytopenia is there, okay, and leukocytopenia is there, and we can see erythrocyte also less, it is anemia. So erythrocyte low, leukocyte low, and platelets also low. 200 is the normal value and 45. So this is a condition called pancytopenia. Okay, you don't have to write it or remember it, but if all main things like platelet low, WBC low, RBC low, then this is a condition of what? This is a condition of aplastic anemia. Okay, so in aplastic anemia you can see these are the things you can see. So erythrocyte will be less, WBC will be less, platelets will be less. If you see this is aplastic anemia. Okay, so this is the hallmark feature of aplastic anemia. So remember it. Whatever the hypochromic, hyperregenerative, it doesn't matter. If three things are simultaneously very less, it is aplastic anemia. Then you can see our next disease is 2.5 erythrocyte. So it is anemia, right? And HB is 68 anemia, and color index is 0.81 hypochromic. Okay, reticulocyte is 16%. It is hyperregenerative. We got another one of hyperregenerative. So some problem is there in the bone marrow activity is very high. And leukocyte is 15. Okay, leukocytosis, if it is high, leukocytosis is there. Okay, leukocytosis, and leukocytosis 15 is there. Okay, and band neutrophils, everything is okay. Band neutrophils, here we will learn about shift. Okay, and what is shift, that we will learn in WBC section. Okay, if I will tell you in the basic, segmented neutrophils are matured ones, band are young. If young cells are high comparing to the matured cells, we can tell it is shift to left. I will teach you everything in shift. I will make you master in finding the shift in the upcoming sections. Okay, now we just need to know there is a shift to left. You have to write shift to left up to band neutrophils. Okay, band neutrophils, and you can see lymphocyte is compared less. Okay, platelets is normal, so there is no problem in platelets. Poikilocytosis and anisocytosis are present, which means the cell size and shape is in defect. Indirect bilirubin is increased in blood. So what disease it is? If indirect bilirubin is increased, you can see the defect in anisocytosis and present. So it is a condition called hemolytic anemia. Okay, I will tell more about this now. Hemolytic anemia. So hemolytic anemia are more types are there, like thalassemia is another hemolytic anemia. Glucose 6 phosphate deficiency is also hemolytic anemia. Then what else are there? The hereditary spherocytosis, these are also what? Hemolytic anemia. So what is hemolytic anemia? Hemolysis means destruction of red blood cells, destruction of RBC. Okay, so what will happen in hemolytic anemia? If red blood cells are destroyed, this indirect bilirubin is a thing, it is a byproduct of hemoglobin. Okay, so hemoglobin will occur in it will accumulate in our blood. So the byproduct of hemoglobin destruction cells are there in blood. So hemolytic anemia, we can see this increase in blood. And poikilocytosis is there because cell size and shape is altered. So we can tell it can be hereditary spherocytosis. Hereditary spherocytosis, some can also write non-hereditary also you can write, but hereditary spherocytosis. Okay, hereditary spherocytosis. Okay, and if you don't remember anything, just write hemolytic anemia. If they mentioned something like microspherocytosis, you can tell hereditary spherocytosis. If it is not, you can also write non-hereditary spherocytosis. Hemolytic anemia it is actually. Okay, it is all are its type. Okay, now we can see erythrocytes is 10. So first time in the till now we get erythrocyte high, so it is not anemia. So if erythrocyte is high, erythrocytosis. Okay, so erythrocyte is high, so we got hemoglobin normal, color index is hypochromic, reticulocyte is 2, it is hyperregenerative. Okay, platelets are 600. Okay? Leukocyte is high, leukocytosis. Okay, so here you can see shift up to left shift is there up to myelocyte. While on WBC we will learn more about the shift. Okay, myelocytes are high. Okay, up to shift to left up to myelocytes, and you can see blood viscosity is increased. Okay, what is this condition? This condition is called polycythemia vera. Okay, polycythemia vera or erythrocytosis. Primary erythrocytosis, it is polycythemia vera. Erythrocytosis. Okay, so what will happen? In your normal blood, erythrocytes is high, comparatively high. Okay, so what will happen? More in your blood, more erythrocytes are there, your blood viscosity is high. Okay, like it will flow very hard. Okay, so more erythrocytes, like in a liquid, if you put more and more things, the liquidity, like how I will explain it, is like it is more solid than, it can't flow that much faster, it will flow slowly because of the viscosity is increased. Okay, like that, learn erythrocyte is high. Now these are the basic things. Now we will learn about some other diseases, same like whatever we have gone through. In this 2.6 erythrocyte, it is anemia, color index not provided, and reticulocyte is hyper-regenerative, HB is low. Okay, so these not provided anything, and they only give the Haynes bodies. Okay, so if Haynes bodies is there, it is enzymopathy. Okay, enzymopathy, it is defect of enzyme, that only. So it is a type of hemolytic anemia actually, hemolytic anemia, but you have to write exactly G6PD deficiency. If you see, you have to learn, if you see Haynes bodies, it is glucose 6PD deficiency anemia. And you can see osmotic resistance is decreased. Okay, there we have, so indirect bilirubin is increased, it is hemolytic anemia. Okay, you have to learn it is hemolytic anemia. And if in some cases indirect bilirubin is increased plus osmotic resistance is decreased, you can tell it is hereditary spherocytosis. In poikilocytosis, change in size and shape plus osmotic resistance is decreased, it is because hemolytic anemia, it is prone to destruction. So red blood cells are prone to destruction, so osmotic resistance is decreased, so you can tell it is hereditary spherocytosis. Okay, spherocytosis because of poikilocytosis you saw. Okay, and this band neutrophils is high, shift to left. Okay, shift to left up to band. Okay, so everything is, color index is hypochromic. Okay, you have to write everything like I explained it in the beginning, that's why I am not telling in everything. Okay, but I am not writing. Okay, so you just remember it like that. Now this erythrocyte is 3.0, it is anemia. HB is low, anemia. Color index we have to calculate it by 75 into 3 divided by 3, 30.300. Okay, like 3 digit, first 3 digit. Okay, like that you have to calculate, and you will get the answer. Reticulocyte is high, so hyper regenerative, and everything you have to write. After that you saw target like cells, so it is in thalassemia. Okay, if you saw like that, it is thalassemia. And if you saw sickle like cells, it is easy sickle cell anemia, because the size of the RBC is sickle like, sickle cell anemia. Okay, so that's all about RBC disorders. Okay guys, now we will dive into the topic of WBC disorders. Okay, now you all know how to find the RBC disorders. Okay, RBC disorders are, anemia and blood loss anemia, aplastic anemia, and that G6PD deficiency, hence body disease come G6PD deficiency, target like cells, thalassemia, and these are the things, and sickle cell and deficiency anemia. So if you know all that, we will cover into WBC disorders. Okay, so what are the basics? This is the main thing, so focus on this basics. Okay, leukocytes will be 4.0 to 9.0. This is the normal value. If it is less, leukopenia. If it is high, it is leukocytosis. Okay, and before going further, you have to know WBC is an young, WBC is an adult. Okay, so before becoming an adult, WBC must go through its child stages. Okay, so it was once a baby. So the baby is myeloblast. You can see myeloblast. Okay, so myeloblast became promyelocyte, and it became myelocyte. It became metamyelocyte, and metamyelocyte became band neutrophils, and it became the segmented. And what segmented neutrophils will become in the WBC? Okay, this is the order of maturation. You have to by heart these things. Okay, so you have to by heart this, then only your WBC disorder life will be easy. Okay, myeloblast, promyelocyte, myelocyte, metamyelocyte, band, and segment. So you can see the youngest one is myeloblast and the matured one is segmented. If how now we know the young is myeloblast and the matured is segmented. So if segmented is there, okay, segmented is there, and segmented will be around 50, 35 to 70. Okay, so 54 percentage segmented and 7 percentage band. So it is shifted to left, because from the matured it is going towards the young, so it is left shift. From the young it is going towards the matured, it is right shift. So that's how shift will works. I will tell once again, like, while we go into shift. Okay, so myelocyte, and in normal cells metamyelocytes and myelocytes will be 0, because if there is presence of any young cells, it is abnormality, because it have to be matured in order to become WBC. The promyelocyte, metamyelocyte, if it is present, it is an abnormality or any pathology. Okay, now we will learn the shift. Myeloblast is there, segment is there. If segment is matured and if band neutrophils is high comparing to segmented, it is shift to left up to band neutrophils. If the metamyelocytes is high comparing to segmented, band also high, but metamyelocyte also high, shift up to left till metamyelocyte. Same like myelocyte will be high up to myelocyte, we have to tell left shift. Everything will be left shift only. Okay, now what we will learn is right shift. If band is less or normal, segmented is high, it is right shift, right? Because this is the young ones, these are the matured ones. If matured ones is high comparing to young, it is right shift. If left is high comparing to right, it is right left shift. Okay, now diseases. Okay, so first one, erythrocyte is normal, color index is hypochromic. Okay, hypochromic, and leukocyte is okay, leukocytosis. If leukocyte is high, leukocytosis, and you can see band is 11, normally is 1 to 6, so it is shift to left up to band. Okay, band neutrophils, and this is a condition, leukocytosis with the shift to left. So we can also tell this is first degree. Okay, if leukocytosis up to band, it is called first degree also, we can tell. Okay, so it is over, and what it is, erythrocytes are below normal. No, it is normal, and color index is normal, everything is normal, but leukocyte is 18. It should be up to 4 to 9. Okay, so it is high leukocytosis and shift is there up to band. Okay, you see, so the 12% is there, so it is shifted to left up to band neutrophils. Okay, so it is first degree. Okay, first degree leukocytosis, first degree. I will tell one thing more, it is hyporegenerative. Okay, and how it is hyporegenerative I will tell you. Okay, just learn leukocytosis. If it is a first degree, it is hyporegenerative. If it is second degree, it is regenerative. If it is third, it is hyper. So we are starting from the hypo to regenerative to hyper in severe cases, third degree. Okay, it is second degree, first degree. Okay, so that's it, and we will, so this is the thing, this is leukocytosis and up to metamyelocyte. Okay, and this is shift to left up to metamyelocyte, and leukocytosis. If it is up to metamyelocyte, it is second degree regenerative. Okay, second degree regenerative. If it is up to, you can, I will teach you here. Okay, if it is till band neutrophils, it is first degree. If it is still metamyelocyte, it is second degree. If it is still myelocyte, it is third degree. Okay, like that only. So it is second degree up to metamyelocyte, second degree regenerative. Okay, and you can see this leukocytosis up to myelocyte. All three are high. Shift up to myelocyte. Shift up to myelocyte. Leukocytosis third degree hyper regenerative. Okay, this is how you have to learn this leukocytosis, three: first degree, second degree and third degree. If it is up to band, it is first degree. If it is up to metamyelocyte, it is second degree. If it is up to myelocyte, it is third degree. Okay, and this is leukocytosis, you can see 36. And what else you can see? Okay, so this is the main things. We are going towards the main three topics. Okay, and you can see shift, right? Myeloblast. Okay, myeloblast is there. This is the thing, everything is little high. Leukocytosis also there. Leukocytosis, anemia because of erythrocyte. We have to write, even though it is a WBC disorder, we have to write whatever they are given, we have to write everything. Okay, anemia, hypochromic. Okay, and what else? Shifted to left up to myeloblast. So this is the thing, Leukemoid reaction. Leukemoid reaction, I will tell you. The Leukemoid reaction is something, it is an infection or inflammation, like your body is mimicking the cancer. You have no cancer, but your body is mimicking that you have cancer. Like cancer, every criteria will be high, but it is not at all cancer. It is not chronic or anything. And also, if you are seeing toxic granules are present, okay, it is also a hallmark feature of leukemia reaction. You may have some variants, like it have toxic granules, but leukocytes are less, and like everything. But if toxic granules are there, it is what? Leukemoid reaction. Other nothing will come in our case in NSMU. Okay, and leukocytosis, everything we learn. Okay, and shift to left, Leukemoid reaction, and we will learn Leukemoid reaction and chronic myeloid leukemia. It is similar, but we will learn how to distinguish between. Okay, chronic myeloid leukemia. Okay, before that we have to know about this. This is eosinophil. Segmented neutrophils are 89. So we also, band is high, but this is segmented neutrophils are high. Okay, so band is less, so it is shifted to right. We also leukocytosis, but this is leukopenia with shift to right. Okay, then that's over. Up, shifted to right only. We don't have to tell it is up to new segment. It is shifted to right. Okay, and this color index hypochromic anemia. Then what else? Leukocytes high, leukocytosis, and this is the distinguishable feature. Look, metamyelocyte, promyelocyte, everything is 0%. Okay, so it is in normal, but myeloblast is 80%. So only myeloblast is 80%. Others are 0. It is called hiatus leukemiatus. Hiatus leukemiatus. Like this, you have to tell if your teacher will be Dobala, you have to tell hiatus leukemiatus is present in this case. What is this case? Myeloblast is present and it is 85. It is relatively high. 0% is normal and it is 85. And others are 0. If others are 0 is the hallmark feature of this, it is acute myeloid leukemia. Okay. And platelet is 100. So thrombocytopenia. We have to write whatever present, we have to write it. Okay. You can see the promyelocyte is 7 degree, myelocyte is 5 degree, everything is there. Segmented, everything is there. So shift is there, left shift is there up to promyelocyte. But this is same as Leukemoid reaction, right? Leukemoid reaction, you saw this, everything is high. This also everything is high. Leukocytosis also high. Same in Leukemoid reaction also high. Leukemoid reaction is just mimicking the chronic case, like it is mimicking the cancer. So the distinguishable feature here is 3% and 6% of basophilic eosinophilic association. If it is there in leukemia reaction, you can see it is 0 and 1, and in this case it is high. Basophil is from 0.5 to 1. It is 3% here. Okay, so it is high. Eosinophil is also high. So both are high. It is all and only chronic myeloid leukemia. Okay, so that's over. Erythrocyte 3.5 already normal. Okay, so that is the hallmark feature. Okay, and leukemia reaction and chronic myeloid leukemia, you have to distinguish it. Okay, and this leukocyte is 200 and lymphoblast is 60%, lymphocyte is 10%. This is where lymphoblast is young cell, it is high comparing to lymphocyte. So it is acute lympholeukemia. In your exam, there won't be acute lympholeukemia. In the final exam of NSMU, there won't come acute lympholeukemia. It is only for demonstration purpose. Okay. In your workbook also it is there, but it won't ask in exam. So you can skip it if you want. If you can learn, it is good. So if lymphoblast is less and lymphocyte is high, it is, and leukocytosis is there, it is, and Botkin-Gumbrat cells are there, it is chronic lympholeukemia. Okay, and it will be there in exam. So you may find this cell or you may not, but lymphocyte will be high comparing to lymphoblast. Presence of lymphoblast or pro-lymphoblast may be there, but distinguishable features is lymphocyte is high comparing to lymphoblast. Okay, so comparison, we know acute, how acute myeloblast is high, and in leukemia reaction, how chronic myeloid leukemia, it is 3% and 6%. Basophilic eosinophilic association is there. Leukemia reaction, either toxic granules will be present or all will be little high. Leukocytosis will be high, everything, but basophil eosinophil association won't be there in that thing. And urine analysis, okay, so they will give a sheet with RBC plus urine analysis. Okay, you have to know diuresis is 800 to 1200 is normal. Specific gravity 10 and 1025. What is specific gravity? I will tell you. Protein is 0.6 is glucose absent, leukocyte is 0.0 to 5 in high power field, and you can see erythrocyte is not there. Okay, good. Hyaline cast 1 to 2, red blood cell class, nothing, mucous bacteria. So in normal urine, there won't be any erythrocyte. Okay, you are passing your urine, there won't be any erythrocyte, like unless there is an pathology. Okay, there is a stone or glomerular nephritis or nephrotic syndrome or anything is there, only pyelonephritis, only there will be erythrocyte or something. Otherwise your urine will be good, there will be no erythrocyte, there will be no cast, there will be no leukocyte cast, but leukocyte cast is 0.0 to 5 will be normal. In protein also it won't be there actually, but up to 0.066 gram might be there, if not also good, but if it is there up to that, it is okay. And specific gravity, what it is, like that, it is viscosity. Okay, if urine is more concentrated, this specific gravity will be high. Okay, so these are the concept you have to know in order to master every 4 diseases in urine analysis. So if specific gravity is there low, the urine is diluted. That means our kidney, what the function of kidney, it is making the urine concentrated. Okay, and if it is diluted, kidney function is impaired. So we will dive into each diseases, and before that, microscopic hematuria. What it is, if the hematuria is around 20 to 40, it is microscopic hematuria or microhematuria. If it is macrocytic, it is 80 to 100. Probably you will ask, what if it is between 50 to 70? You can tell it is macro. Okay, no matter what. But these are the basics of that. Macro and macroscopic and specific gravity, as I told, it is the concentration of the urine. Okay, and in this specific gravity is 1043. Okay, so it is hyperstenuria. If it is high, hyperstenuria. Okay, protein is 0.86. 0.066 is normal, 0.086 is high. So it is proteinuria. You have to write is proteinuria. Leukocyte is 0.5. It is normal. Erythrocyte is macrohematuria. Okay, macrohematuria. And hyaline cast is present. RBC cast is like little something in urine when we see it in microscope. Okay, the color is yellow. Color can be red. This is the case of glomerular nephritis. Okay. In this case, why specific gravity is 1043? Because glomerular nephritis, some glomerulus is impaired, so other whatever remaining is trying to make the working harder because they already inflamed and they can't make the urine concentrated, so others are working towards making urine concentrated. That's why urine became more concentrated than normal. Okay, that is the hallmark feature of glomerular nephritis, but it can be hypostenuria also, because if kidney is completely in the chronic stage, it can be hypostenuria, but most probably it is hyperstenuria. You have to look for the RBC cast and hyaline cast like that. Okay, little proteinuria only there. And this specific gravity is low. Okay, protein is 30. Okay, high protein is the hallmark feature of nephrotic syndrome. Okay, nephrotic syndrome. Okay, leukocyte is, but it is microhematuria is present, it because of 40. Hyaline cast, RBC cast, waxy cast, if this is present, it should be glomerular nephrotic syndrome. If you have experienced high protein, specific gravity is low because kidney is gone, kidney's function is not working properly, so urine is not concentrated, it is diluted, so it is nephrotic syndrome. Okay, and specific gravity is normal. Okay, good. 0.66, it is not normal. 0.066 is normal. They will give this for confusing you, so don't confuse. 0.66 is high proteinuria. Okay, little bit, but glucose is absent, leukocyte all, so there is leukocytes, and erythrocyte is there 80 to 10, so it is micro hematuria. RBC cast is not present. What waxy cast is present and bacterium is present. If bacterium is present, it is pyelonephritis. So if you see bacteria, it is pyelonephritis. If you see bacteria with any cast also, it is pyelonephritis with casturia. You can tell waxy cast as casturia, and all others are present. Little protein, if protein also can be normal. It is hallmark feature is bacteria, because pyelonephritis bacterial infection of the kidney. Okay, so in specific gravity normal, protein is almost high, but okay. and glucose is absent, leukocyte is all, and RBC cast, waxy cast bacterium present, and bacterium also present, but oxalate or urate or crystals present, should be urolithiasis. Urolithiasis, but bacteria won't be present. Okay, sorry, bacteria won't be present. If bacteria is present, it is pyelonephritis. If bacteria is not present, but any crystals, urate, phosphate, any phosphate also, okay, phosphate is coming, urolithiasis. That's how you have to learn it. And specific gravity normal. And what you have to know is, in pyelonephritis, it is the bacterial infection, and urolithiasis, it is the stone is present. If kidney stone or something is there, RBC cast can be come through the urine. Okay, so and erythrocyte changed and unchanged, that is the thing I have to tell you. If it is changed, which means the RBC pass through the urine is changed. If it is changed, it is coming from kidney. If it is coming from kidney damage, it is changed. Okay, like nephrotic syndrome, glomerular nephritis, it should be changed. In bracket, they will give changed. If it is not changed, it is because of urolithiasis or pyelonephritis. No, urolithiasis, it won't be changed because it is coming from urinary bladder somewhere. It is that's why it won't be not changed. Erythrocyte will be present in the case of urolithiasis because it is not coming from the kidney. If it is coming from the kidney, it should be changed because it is passing through a filter which is damaged. It is passing through that, it won't filter very good, it will damage. It is because it is changed. That's how you will know. Now, if you found this video helpful, you just subscribe it and like it, so I can make more videos like this, and I will try to make more videos regularly from after 2 months. Okay, so keep subscribed, and if you found this valuable, please give your valuable feedback in the comment section so I can improve myself. This is my first video in this channel after a long time. I have been making videos in the past, but I deleted everything, and because of the low quality of the videos, now I am trying to make the videos in high quality. So keep supporting, and if you found this, subscribe and stay tuned for more videos in all year. I am planning to make more time into making videos, and thank you.